Hi everyone, I'm Dr. Claudia Kim. I'm a cosmetic surgeon here at New Look New Life, and today we're going to talk about chin augmentation. When it comes to assessing someone for facial asymmetry or proportions, there is a general rule that we sometimes use called the facial thirds rule, and that is performed by dividing the face into 3 equal parts, okay? So the point is from the top of your forehead to the middle of your eyebrows to the tip of your nose or the bottom base of your nose to the tip of the chin. And so ideally that should be an equal 1/3, okay? I'm all forehead, so that doesn't count. But when we assess someone for chin augmentation or the need for kind of making the chin a little bit more enhanced, is usually for people who do have, let's say, a weaker chin or a recessed chin. And there are different modalities that we can use to kind of give your facial asymmetry a little bit of an improvement. So another rule that I like to use in addressing for the chin, okay, or evaluating for the chin, is you take a photo, and you take a photo, either a selfie or have someone else take a photo for you, and you take a photo of your side profile, okay? And with that side profile, you draw a line, or using a pen or a piece of paper, you draw a line from the tip of the nose to the bottom of the lip and see where the chin falls. Ideally, that should be in a straight line. But if you notice that the chin is significantly behind that imaginary line, you could probably benefit from having some kind of augmentation. Now, the different kinds of approaches that we have in our toolbox is you can use fillers, okay, to give yourself a little bit of projection, okay? You can also lengthen the chin by putting some on the bottom part, but most of the times it's going to be in front of the chin to give you a little bit more projection. Now, because fillers are not permanent, it is something that you will have to do on a regular basis. Other considerations is that, you may need a significant amount of filler, and there's a limit to how much filler that we can put, and so that's something that definitely to consider. But if you are looking for a little bit of a projection, then fillers might be the first step for you. Now, for the more permanent options, we do utilize implants, okay? So silicone implants, and this is just the model. The real implant is not blue, but you put the chin implant kind of where the chin needs to be projected, and so you make an incision underneath the chin. The incision hides really well and does become fainter in time, and it's only really visible if someone's really close and staring at the underside of your chin. We can do this under local anesthesia, which means that there is lidocaine, so something that is injected. You're still awake, but you're completely numbed up in that area, and the procedure can take anywhere from about 30 to 45 minutes. Now, there are different sizes of implants, so there ranges from just a little bit of projection. There's also different styles. So in some cases, males tend to have more of a squarer chin versus females who like to have more of a pointed chin. So there are different options that you can explore, and you would speak with your surgeon to really come up with the right implant size and design that suits you best. So restrictions are that you are not allowed to exercise for 2 weeks. Also, you have to avoid any kind of direct pressure on the chin. So when you're, have your hands in your hand, you're not allowed to do that. You can't sleep on your stomach, because potentially sleeping on the chin area can potentially move the implant. And I can't stress enough, you can't be punched in the face. So my boxers or, my fighters, that's something that you may potentially have to forego if you are considering the longevity and the proper position of the implant. Now, in the beginning, you will have some swelling, obviously from the local anesthesia and from the surgery itself. So you will notice that you'll have more swelling in kind of the lower face area and even down to your chin. You can also have bruising, but usually all bruising will resolve in about 2 weeks. Now, the implant itself, it is a permanent device. You don't need to change it. There are no guidelines about the interval of changing, like there are breast implants, right? Breast implants, you'll change out every 10 years. But with the chin implant, as long as it's not causing you any issues, then you can just keep them in forever. Now, other considerations is that, you always have to make sure if you have any dental infections, right? So any infections of the tooth, that's something to consider, and you would have to talk with your dentist to make sure that the infection resolves fully before you put any kind of implant into your face. Now, in some individuals, the chin implant might not be the answer. In some situations, you may actually need jaw surgery called a genioplasty. So if you have a significant significantly recess bone structure, that surgery is going to involve a little bit more, and that's something that we can talk about in another video. But for chin augmentation with the implants, it's really just to enhance the projection of the chin and potentially of the jowl area and the lower face. There are custom implants that do the augmentation of the entire jawline, but that is a custom implant that needs a CAT scan for further imaging, and it needs to be designed by the company, and it can take more time in terms of the actual procedure itself with increased downtime. Now, for the downtime, so I mentioned that you will have some swelling, you will have some bruising. You do have to wear this very fabulous flattering chin strap. So it's a Velcro chin strap that we use, and you do have to wear it for 7 days. It's mainly to keep the implant in place, so prevent it from shifting or migrating. So that's something that you do need to prepare for. And then after the week, you do still have to be aware of not putting any extra pressure into the lower face area. Again, like the resting of the hands or sleeping on your stomach and the direct contact. So, and let's say down the line, you want to remove the implant or change the implant for a different size. That's very easy to do. You go through the same incision and you remove the old implant, and you either take it out completely or you can replace it with a new one. So the downtime for the removal or the replacement is significantly less than the original surgery. So I hope I cleared up any questions that you guys might have about chin augmentation. If you like these videos, please follow and stay posted for more educational videos like this. Bye.